you might have a mum that lives like day to day, like hand to mouth, if that makes sense, and needs to take a young child to a clinic and will have to utilize like a week's earnings to catch some form of public transport or multiple points of public transport to travel hours to get to a clinic. When they arrive at the clinic, there might be super long waiting lines. They might not have the medications available to be able to treat whatever's wrong. She might not get the right diagnosis because the skills of the healthcare workers that are there are limited, or they haven't necessarily been trained, or they don't have the equipment to do the right investigative procedures. And so the expectation is often just if a patient can walk away feeling like they've been seen and heard and their healthcare needs have been met, that is the like ultimate outcome, because the worst outcome is they then have to take all the money to go back home, and then they often can't afford to come back the next day or the next week, and the healthcare condition deteriorates. Often these patients will just want to be able to walk away with something, like a medicine that they can take, an injection that they've received, like a procedure that was done, if it was like a wound or something of the sorts. Whereas I think for us, like digital perception is much more prominent as a kind of barrier to accessing healthcare of the sorts.